A trip to the emergency department at your local hospital is something that most people try and avoid, but a new study shows that you're more than likely going to opt for the ER if you've recently had a virtual visit with someone other than your family physician.
I was wondering when it started. Can you tell me a little bit more about that and, how long it's been going on for?
Virtual care is really best delivered when it's from a person, a clinician who knows you and who has access to your health history and who's able to actually see you in person and follow up if needed.
While virtual care has become that much more common since the pandemic began, there's now proof that the doctor-patient relationship remains important. A quick phone call with a medical service may do, but the trust factor continues to play a part, according to information gathered by ICES, UHN, and Unity Health Toronto.
We compared people who had a virtual visit with their regular family physician to those who saw a doctor who was outside of their usual care team.
Data for over 5 million Ontario residents showed that patients receiving virtual care with someone other than a family physician were 66% more likely to go to the ER within 7 days afterward. 25% would follow up with an in-person visit, and 88% wanted another virtual appointment in that same time.
That patients' needs weren't fully met by that visit. In many cases, it may relate to not being able to call the patient in for an exam, or maybe it relates to not having that existing health history, that awareness of that patient because it's the first time you're meeting them.
Secondary analysis showed patients seen by virtual only or direct-to-consumer clinics were 3 times more likely to visit emergency within 7 days. Virtual care does have an advantage for best use of a physician and a patient's time, but study results show that it can have the opposite effect.
If we implement virtual care in a way that's disconnected from relationships, it can actually cause more churn in the system. So it means like more repeat visits or unnecessary visits to whether that is a repeat virtual or in-person visit or whether that's a visit to the emergency department.
It's estimated that 2.2 million people in Ontario do not have a family physician, and so they don't have the advantage of that doctor-patient relationship, meaning virtual care is their only point of access. Mark McAllister, City News.